Well, Dr. Calvin Sun joins us now. He's a practicing physician as well as a clinical assistant professor of emergency medicine. Calvin, thank you for joining us. Are you surprised, as I am, that quite so many Americans are traveling? We're told 2 million in the last 24 hours. Does that surprise you?
No, it doesn't. People are fed up, they are tired, they're frustrated, and a lot of people feel like they did their part. Everyone got fully vaccinated, some people got boosted. There's a sense of entitlement that we were very familiar with during the pandemic, way before a vaccine. So I think a lot of people who felt that they were team players, they did their part, and realizing that at the worst, it's mild illness if they're fully vaccinated and boosted, especially so, then it's an individual decision they want to take. It's a risk assessment, calculated risk for themselves, and not really paying attention to the bigger picture and whole that even there's way, way more cases that could still mean more hospitalizations, but people are taking their chance now because they felt that they stayed out last year for a holiday season. That was their sacrifice, and they can only do so much before things explode, and that's what you're seeing right now.
Right. Well, it's certainly true, isn't it, that organizations like the World Health Organization in Geneva have said very vocally that Omicron spreads more easily, yes, but is less severe than Delta. I guess that message has hit home, right?
Yeah, and we don't know it's still a moving target in terms of the data. We don't know if it's because it's all of us fully vaccinated, that's a new baseline, and that's why it's milder, or that the data is coming from countries with younger populations, so they're more likely to fight off severe illness. But the trending data is the new baseline is being fully vaccinated, and as a result, I take what I can get. The end result is milder disease.
Now, do you sense that there is absolutely no appetite whatsoever from anybody in American authority, from the mayor of New York to the president of the country, for any more kind of formal lockdowns like we are seeing actually in parts of Europe?
I hate to generalize because I think I'm pretty biased as a New Yorker, born and raised, that we were really good with the lockdown. We played our roles. We didn't complain, and we yelled at other New Yorkers to turn on their masks, and people yell back, but then say, thank you, you're correct. But the rest of America is very different from New York. Of course, none of us, who wants to go through a lockdown again? Nobody does.
No.
Who likes shots? Nobody does. But, it depends on the context and the circumstances. How bad is it really that would require a lockdown?
No. I mean, I know you're a medico and you can't really talk about politics, but there is a real difference, don't you agree, between what's going on in Europe and the way they're approaching it? Netherlands is under pretty much lockdown. France has banned people from the UK coming in. All sorts of things are going on that are not happening here. I mean, would you prefer that they were happening here, maybe?
I mean, it really depends on what communities you're talking about. I think that Manhattan being fully vaccinated, some of us are now getting boosted with outbreaks. If it's really, really high, that depends on communities that have no outbreaks and also fully vaccinated and boosted. Controlled lockdowns may be a more nuanced and more responsible answer and approach rather than a generalized sweeping lockdown where a lot of people feel like they did their part. Why should they get punished? But everyone's doing something different. We have to remember that United States of America is kind of a republic of 50 different countries with their own different rules.
Exactly, and a very big place as well. I mean, certainly far bigger than Britain, for example, where I come from. Now, just finally, do you think that there will be a big uptick now in, I don't know, Delta and Omicron because so many people appear to be determined, as you've said, to have Christmas with their families this year?
I think that it also depends on where you're going as well. Like I think all the patients I know that have come from Florida back to New York have tested positive, for example. I mean, every community is different. Of course, I can't really make predictions, but it's the speed at which Omicron has infected all of us. I do believe like high school and college relationships, the hotter the fire burns, the faster it burns out. And, that is the hope that it will just peak at the early January and it'll dissipate. However, we did see with SantaCon. So SantaCon came at the worst possible time, and that's why we're seeing a lot of burgeoning cases in Manhattan a week afterwards. You're having this travel after a lot of the fire has burned out. So the timing also can play a role. I can't make predictions, but the hope, not the expectation, the hope is that we've seen the worst of it by early January, and then by the end of January, people can't get reinfected with Omicron again. But the expectation is, prepare to fail, fail to prepare, prepare to fail, and I am ready for the worst.
We won't hold you to it, Calvin, don't worry. But thank you very much indeed for your expertise. We appreciate it. Dr. Calvin Sun, thanks very much.